Microsoft has, in recent years, begun to view the health marketplace in terms of the whole ecosystem of healthcare. So if you were to look at many other companies, including Microsoft, going back a number of years, we had business strategies for the public sector health marketplace, and then we also did for the commercial marketplace, for life sciences and payers and providers. Where we're going right now is we're looking at the end-to-end health marketplace by putting the consumer in the center. So we're viewing the consumer, the individual, and we're thinking of the different systems and providers and services that the individual comes into contact with. The result of that is we're now collapsing or combining our vision so that we look at an integrated approach. Our technology is targeted not only towards, for instance, in the public sector market, towards what's going on in Medicaid or Medicare, but we're actually taking knowledge and ideas both on the business and the technology side from that market, and we're extending it into the commercial health marketplace. Similarly, we're taking ideas on managed care in the payer market and extending them over to the public sector marketplace. We really are one of the very few companies that actually has a reach into that end-to-end system, so that increasingly when we convene discussions at a policy level, we're convening them with federal and state health leaders. We're also bringing in life science and device manufacturers, federal public health officials, large payers, because where we see this market moving is a much more integrated approach. And as was mentioned a number of times in this discussion, I mean, if you just look at Medicaid managed care, you're starting to see a convergence of the commercial and public sector health markets. That's an overall strategy that we have. The point I mentioned earlier, all of this focuses on the consumer. If you're looking at the real question of how we're going to drive down cost in healthcare in the country, it's through the engagement of the consumer. The consumer becoming more active in monitoring their own health, communicating with the health systems about their own health, choosing what is the best approach for care. We see that as a market both in the US and globally. We see this as a time where that is about to occur in a way that we haven't seen in the past. And that's because consumers, whether they're working in businesses or even if they're a recipient of Medicaid, they're very digitally literate today. The teenagers and even the adults who have access to mobile devices are communicating about everything from education to healthcare to purchasing products to search engines. So as we look at this market right now, we are looking at connectivity from the consumer across multiple systems. And the third general theme I'd mention in this regard is Microsoft is extremely focused on privacy and security. Because as we look at the question of a consumer's health records a few years from now, flowing from mobile devices, from providers to a person's mobile device, back to other providers into personal health records, we know the importance of the privacy and security of that data, both with respect to HIPAA and other laws, but just generally in terms of the expectations of the public in the US and globally. So to sum that up, we're looking at an end-to-end view of the healthcare marketplace. We're looking at the consumer as the center of that, and we're looking at our technology development from the enterprise to the consumer. And around all of that, we are focused on privacy and security. And we think that is what will enable the connectivity of health records and the ability to drive down costs and improve outcomes. A key part of that, when we look at those themes I've just mentioned, is the efficiency in driving down cost. And so we put particular emphasis upon strategies and tools that can achieve that, including the fraud and abuse solutions and the vision that Aslan has embarked upon.
And if I can just add something to that, Bill, thank you. That's a very good point, because one of the reasons that we are very excited about the Answers product is it takes advantage of this connectivity and the connectedness that Microsoft is building, both in knowledge and in technology and in data, because you can't really fight fraud in a silo. I mean, you have to connect all the pieces. And one of the things that the Microsoft technology and the Microsoft approach provides us is we are able to operate in a global sense regarding healthcare, such that they're very simple things, like if a provider has been, for lack of a better term, disbarred or eliminated from practicing in one state, and they can just move to another state and start all over again. Well, with a solid connected database and a connected an interactive approach, then there's a national visibility into who is really authorized to perform services, who's authorized to receive services. And those are just some of the small things that may not appear to be much on a micro level, but when you consider it nationally, these are big issues for people, for the healthcare programs and people who are trying to fight fraud and waste in healthcare. So that is really a good point, Bill, that connectedness and connectivity is key to the success of any fraud, any fight against fraud and abuse.